I'm Dr Mohamed Najib. I'm a Paediatric Haematologist and Oncologist and a stem cell transplant Haematologist at Sunway Medical Center in Bandar Sunway. Paediatric Haematologist and Oncologist is a pediatrician who is subspecialized in the care of children with blood disorders and childhood cancers. Some pediatric hematologists or oncologists like myself are subspecialized in performing stem cell transplant for children with various disorders. So I graduated from University Science Malaysia back in 2003. I then pursued my career by doing my Masters of Pediatrics from University Kebangsaan Malaysia back in 2011. After that, I was posted as a general pediatrician to Hospital Miri. My mentors at that time encouraged me to take up the field of pediatric stem cell transplantation because in our country at that time there were very few pediatric stem cell transplant hematologists, and I decided to take up the challenge, and I've not looked back since then. Cancers in children, just like in adults, can affect any organ in the body. The most common childhood cancer is what we call leukemia, which is cancer of the blood. The second most common childhood cancer are brain tumors, and lymphoma, which is a cancer of the lymph nodes, are the third most common childhood cancers. Stem cell transplant, on the other hand, can be used for various disorders, such as in certain forms of leukemias or blood cancer. They can be used to treat thalassemia, which is a blood disorder. It can be curative in bone marrow failure syndromes such as aplastic anemia, and can be used to treat certain forms of primary immunodeficiencies. Well, a case that I very clearly remember is a case of a 2-month-old child who was born without an immune system. How we treated this child was we did a stem cell transplant when the child was 2 months old. The transplant was a success. Not only is the child cured now, but the child is thriving well and living a normal life, and that is really rewarding to see. Treatment modalities for childhood cancer, among them, number 1 can be surgery, it can be chemotherapy, it can be radiotherapy, and in some cases stem cell transplantation. For example, in a child with leukemia, the child may need chemotherapy as the mainstay of treatment with or without radiation and stem cell transplantation. But on the other hand, let's say a child with brain tumors, these children will need surgery followed by chemotherapy as well as radiotherapy. The exact treatment protocol will depend on the type of cancer, the stage of the cancer, as well as the general condition of the patient. We now have immunotherapy, which is given together with chemotherapy to assist patients to get into clinical remission, meaning which to get rid of the cancer cells. We also have CAR T-cell therapy, which is chimeric antigen receptor therapy. What this therapy does is we take the patient's T-cells, they are then modified in the laboratory and then re-infused to the patient. These modified T-cells will then attack all the remaining cancer cells to assist to get the patient into clinical remission. So patients who have childhood cancer and their families face various emotional and psychological challenges. Among them, fear and anxiety, depression and sadness, isolation, as well as social withdrawal. We assist these patients by creating a supportive environment. We have play therapists who can engage with the child to help the child get their mind off their worries and their illness. And we have clinical psychologists who can assist the child and their families with any worries that they might have. We need to band together to fight childhood cancer.